Nursing NCLEX RN Review Video, Fundamentals of Nursing. In this video, I'm going to talk about the structure and concepts about the actual Nursing NCLEX RN exam. Visit my website www.simplefitnurse.com for more NCLEX content review and a free ebook where I shared my study schedule for passing the NCLEX. Taking the NCLEX exam is not like any other exam you will have most likely written. Therefore, it is important to understand information the National Council of State Boards of Nursing gives you to help guide you on how the exam actually works. Make sure you look at their website describing all of this in detail, which will be in the description box down below. However, in this video, I've summarized what I believe are the key components of their documents. Components of the NCLEX are made up of relatively the same segments every year. This diagram summarizes all the various components of the exam. This is important as it helps guide you on what to focus on studying while you're reviewing concepts. For example, knowing that the management of care and pharmacological therapies make up the highest percentage of the exam, you know to focus more on studying and remembering those contents more. The rest of the document mentions various algorithms that it uses to identify on how you're doing on the test. This is also important because while you're writing the test, you want to know how the questions will be asked and how does the test identify that you're meeting the passing standard. The most important terms that you should familiarize yourself with and understand about the NCLEX exams are: number one, the computer adaptive testing term, the 95% interval rule, or the 95% confidence interval rule. 3, the maximum length exam. And 4, the run out of time rule, or ROOT. Before explaining these, take a moment to like this video if you found it useful. This helps me decide on whether I should make more videos like this in the future or if I should not. Thank you. Alright, so let's get right into it. Computer adaptive testing is a method of testing delivery that uses computer technology and measurement theory. Each test is unique and is based on the needs of the tester. If the test identifies you're weaker in a section, then it will keep asking you questions on that section until you meet the threshold of passing for that section. Then it will move on to the next section until you meet the threshold for that section, and etc. until you eventually pass the exam. The 95% confidence interval rule. Basically, the rule states that it will test you on other areas of the exam when it is 95% certain that you have the knowledge needed to pass that section. Essentially what we talked about previously. It will test you until it is 95% sure you will pass that section next time it asks you a question. The run out of time rule. If the candidate has not answered the minimum number of required items, the candidate automatically fails. If at least the minimum number of required items were answered, the computer looks at the last 60 ability estimates. If the last 60 ability estimates were consistently above the passing standard, the candidate passes. If the candidate's ability estimates drop below the passing standard, even once over the last 60 items, the candidate fails. This does not mean that the candidate must answer the last 60 items correctly. Each ability estimate is based upon all previous items answered. This provides emphasis on answering questions that you truly have a good chance of getting right. Do not answer if you're completely unsure. Make an educated guess. Think of the stuff you know that might be able to help you answer the question correctly. Think of nursing content that you could use to rationalize and pick the correct answer that way. This is how each test is so unique and why you must know all nursing content. It makes sure that you have no weak areas, which makes sense. Imagine being weak in the cardiac section for the med-surg unit and you go into a clinical setting and a patient of yours has a heart attack. That would be horrible for you and the patient. That's why we need to be good in every section. Currently, the NCLEX RN and the NCLEX PN exams can be anywhere between 75 to 145 items. Regardless of the items administered, the time limit for this exam is 5 hours. Breaks during the exam, you'll have up to 5 hours to complete the NCLEX RN and NCLEX PM examination. Total examination time includes a short introductory screen, 2 pre-programmed optional breaks, and any unscheduled breaks you may take. The first optional break is offered after the first 2 hours of testing. The second optional break is offered after 3 and 1.5 hours of testing. The computer will automatically tell you when these scheduled breaks begin. So that's going to be the end of this video of the Fundamentals of Nursing NCLEX RN exam. If this was helpful, please consider giving it a thumbs up, subscribe as I upload new nursing videos every single week, and be sure to stay tuned for my next videos. Thank you so much for watching, and here's how to get to my website now. Hey guys, just thought I would show you how to get to my website. All you got to do is go to Google and search Simple Fit Nurse, or you can go to your web browser and search www.simplefitnurse.com. In my website, I have free ebooks that I've created. I have a free fitness guide, I have a free NCLEX guide, and I have a free nutrition guide that I've created, and it's all free. You can click on the appropriate tabs at the top of my website and you get access to them. I do post blog posts every single week with my videos, and they're helpful if you want to take a look at graphs and diagrams that come along with that. I also have a NCLEX review session where I post all my NCLEX content, so be sure to check those out. Also, if you're interested, check out these videos and be sure to subscribe for more content every single week. Thank you for watching, and thank you for making it till the very, very end. I appreciate it. See you next time.